So good morning, Prof. Assalamualaikum. My name is Muhammad Zaki. So today I will be demonstrating on how to conduct a delivery via spontaneous vertex delivery. Okay, the first thing first, we need to ask permission from the patient, ask consent to assist in delivery of the baby. Okay, Puan, selamat pagi. Saya Arfan, Dr. Arfan. Saya akan attend Puan lah untuk pagi. Jadi sebab ni Puan ni Puan nak bersalin kan. So first thing saya nak kena buat beberapa pemeriksaan lah. First thing saya nak periksa bahagian perut Puan untuk check status bayi tu macam mana. Kemudian saya nak periksa bahagian bawah lah untuk check bukaan tu, dah buka ke belum laluan tu kan. So once buka laluan tu dah buka penuh, saya akan assist Puan lah bila saya nak deliver baby tu. Puan okey tak? Okay Puan kan? Okay. So when we ask the permission from the patient, we can proceed to the abdominal examination. Puan, saya nak periksa bahagian perut sikit lah. Jadi saya nak minta permission untuk silap sikit lah bahagian baju ni. Kita expose bahagian perut lah. Okay. Proper exposure of the abdomen. Then we examine the abdomen. We need to assessing the fetus. We need to look at the fetal lie and presentation, and also the head engagement, the estimated fetal weight, also the liquor, whether it is clinically adequate or not. And during palpation, if I were to feel any contraction, I should time it and plot it inside the autograph. We're done with the abdominal examination. Okay, Puan, dah selesai lah untuk periksa perut eh. Okay, sekarang Puan, saya nak periksa bahagian bawah pula lah. Nak cuba bukaan laluan tu macam mana. Boleh Puan eh? Maaf lah. So now we'll proceed to the next part, which is the vaginal examination. So Paul again asks for the consent of the patient, and I will need the female chaperone to accompany me for this procedure. Okay Puan, saya nak periksa bahagian bawah lah. Nak tengok bukaan laluan tu macam mana. Boleh Puan eh? Jadi mungkin akan tak sia-sia sikit lah. Minta maaf Puan eh. And for this examination, you need to clean your wash your hands and wear sterile gloves. But for this demonstration, I will be using a normal glove lah. So, okay Puan. Position. Kaki udah kat Puan. Kaki. Ask the patient to position the patient in a laparoscopy position. With the legs flex at the knee joint. Then when we're ready, kita expose the patient. Okay Puan, saya akan silap sikit lah. Minta maaf Puan. Expose properly. Okay. So after exposing the perineum, cause me to clean first in one direction. Clean the perineum. Okay Puan, saya cuci sikit kan. Then with the cleaning, so then you can apply some gel, lubricating gel, to perform the vaginal examination. Okay Puan, saya nak masuk Puan eh. Maaf. Carefully insert 2 fingers inside the vagina. From this vaginal examination, I would like to assess the visual score. So what I'm looking for is the cervix. Look at its position, its length, the effacement, the consistency, and also the dilatation. And then on the fetal head, I would like to assess its position and station, and assess if there is any cord present at the presenting part. Assess the membrane, is it still intact or is it ruptured? And also assess the liquor of the patient. Okay. Okay Puan, dah selesai Puan eh. Then we cover back the patient once we're done. Okay, so once the cervix is fully dilated, we can proceed with delivery of the baby. Okay Puan, saya prediksi tadi, kita tengok jalan kat bawah kita buka lah, dah buka penuh. Jadi kita proceed dengan nak deliver baby Puan. Boleh Puan eh. So before anything, before proceeding with the conducting delivery, make sure that we wash our hands or sanitize our hands. Okay. And then we need to don a pair of sterile gloves. Before conduct delivery, we clean the perineal region with cotton swab, and in one direction, clean it properly. Okay, so after we clean it, and assessing when there is a crowning of the fetus head, we decide whether an episiotomy incision is needed or not. So what I will do afterwards, I will support the perineum with one hand, and the other hand I will maintain a flexion of the head downwards. Okay, this is to deliver the fetal head first. Okay puan, and also I will encourage for maternal affect to push lah. Okay puan, push. Okay. 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 So once the head is delivered, we need to check the neck whether there is any cord around the neck or not, and I would like to wait for the head restitution. Okay. Right. So then I would like to maintain a gentle downward traction to deliver the anterior shoulder first. Okay. Gently so till delivered anterior shoulder. Then afterwards I will need the assistance of my softness to give the patient with injection of either syntocinon or syntramethrin. Okay. Then afterwards apply a gentle upward traction. This is to deliver the posterior shoulder. Okay. Right, so then we deliver the rest of the baby. Okay. Then ask the patient, the mother, the gender of the baby. What? Baby boy ke baby girl?
Boy.
Boy. Okay. Then we put down the baby on top of the mother's abdomen to initiate skin-to-skin contact, and we need to clamp the cord. Okay. And here. Here. And after we're done clamping, we need to cut the umbilical cord. Like so. Okay, now the completed part with regards to the delivery of the placenta. But before we deliver the placenta, take samples from the cord blood. Okay, and then we send the sample to screen for the thyroid status, and also to screen for any G6PD deficiency. Okay. So once we're done with that, we'll proceed with the delivery of the placenta. So before that is doable, we should look for the signs of placental separation, such as gushing of blood vaginally, and the lengthening of the cord, and also globular uterus. And if these signs are present, then it's time for us to perform the controlled contraction to deliver the placenta. By using one hand, I will apply upward traction force to push the placenta, the uterus upwards, and my other hand slowly track the cord. Okay, this is the technique we call as a controlled cord traction. Okay, so then slowly we deliver the placenta in a rotational motion. Okay, alright, so deliver the placenta. Okay. Then what we need to do next is to examine the placenta to make sure that it is completely delivered. What we need to look for, examine if the membranes are complete. Okay, examine, and then the cotyledons, count how many are there. Is there any missing cotyledons? And then we need to assess, examine the vessels, umbilical vessels. Make sure that there's 2 umbilical arteries and also 1 umbilical vein. For the final part, we do a vaginal examination to look for if there is any retained placenta, any blood clots, or if there is any hematoma. And clean the perineum of the patient. Okay, and after we're done with cleaning, pat the patient. Okay, and then cover back the patient. Okay puan, tahniah puan, dah selamat dah deliver. And thank the patient. Okay? And of course, after everything is done, make sure that we do a proper documentation of the delivery process. Thank you.